All right, let's jump right in. For about 150 years, one of the most life or death diagnoses in all of medicine, leukemia, has come down to the human eye. But what if? What if a new technology could do that same job, but faster, more consistently, and maybe even more accurately? Well, that's what we're talking about today, a truly revolutionary AI that's doing exactly that. This wasn't just a commonly held belief in hematology. It was dogma. The thinking was that the delicate, subtle art of spotting a cancer cell was just uniquely human, a skill you could only get after years and years of intense training. It wasn't just a medical practice, it was the undisputed gold standard. And boom, this one slide shows you exactly why that gold standard is being completely shattered. Just look at this. A highly trained human pathologist, an expert in their field, takes anywhere from 5 to 15 minutes to analyze a single slide. The AI, we're talking under 30 seconds. This isn't just a small step up, it's a quantum leap in the entire diagnostic process. But of course, speed means nothing without accuracy. So let's first appreciate the old way. And let's be super clear, the skill of a human hematopathologist is nothing short of incredible. I mean, we are talking about a legacy that goes all the way back to the 1850s. It takes years of dedication to train your eyes to see those minuscule abnormalities that scream, something is wrong here. So what exactly are they hunting for? Pathologists are scanning for these little giveaways, these telltale signs, things called hour rods, which are like these tiny needle-shaped structures inside the bad cells, or almost invisible irregularities in a cell's nucleus. It's like a massive microscopic visual puzzle. And for a century and a half, we were the only ones who could solve it. Until now. And this is where the whole story just takes a massive pivot. See, this AI doctor isn't some futuristic concept. In actual clinical trials, it hasn't just matched human performance, it has surpassed it. This thing isn't an assistant, it's a potential new frontline screener. Now, these numbers are where things get really interesting. You see 98.7% sensitivity. What does that mean? In simple terms, it's amazing at correctly catching patients who do have leukemia. Then there's 99.4% specificity. That means it's just as good at correctly clearing people who don't have it. So bottom line, it almost never misses the disease and it almost never raises a false alarm. And that brings us to what might be its biggest superpower, consistency. A human's performance can change, based on how tired they are or their specific experience. The AI, it delivers that incredibly high level of accuracy every single time, no matter the hospital, no matter the patient. So the big question is, how on earth does it actually work? Well, the magic here isn't just one single trick. The whole system is built on 4 powerful, interconnected pillars of technology, all working together in harmony. Let's break down what they are. So these are the 4 pillars. First, how it sees. Second, how it learns, especially from rare data. Third, how it thinks, beyond just the picture. And fourth, how it's been proven to be safe and effective out in the real world.
Okay, pillar 1, it's vision. The AI uses something called vision transformers. Now, instead of just looking at cells one by one, it analyzes the relationships between all the cells across the entire slide. Think of it like this. It's not just learning words, it's learning the entire grammar of the language. This lets it see the bigger picture and spot these really subtle patterns a person might just scroll past.
Pillar 2 is where the generative in generative AI really shines. So some types of leukemia are super, super rare, which means you can't find enough real-world examples to train an AI properly. The solution? The AI basically becomes a master art forger. It generates thousands of perfectly realistic but totally artificial images of these rare cells to teach itself. It literally creates its own study material. The third pillar is all about context. I mean, a great doctor doesn't just look at one test result in isolation, right? Well, this AI doesn't either. It takes that high-res image of the blood slide and fuses it with the patient's other data, their lab results, their age, their entire electronic health record. It combines everything to build a complete clinical picture, which lets it make a much, much smarter diagnosis. And finally, we have to talk about trust, because this isn't just a cool tech demo. Pillar 4 is all about rigorous, real-world deployment. This system was put to the test on over 12,000 blood smears across multiple hospitals in huge clinical trials. It had to prove itself to show it was safe and effective. This is a battle-tested medical tool. Okay, so we've seen the how, but now for the most important part, the so what. Why does any of this matter? What does this new medical reality actually look and feel like for the people on the ground? Just look at this. The time it takes to get a diagnosis can literally go from days down to minutes. A 68% reduction might sound like just a statistic, but imagine you're the patient, anxiously waiting by the phone for news that will change your life. For you, that's not a statistic. That time is everything. And that incredible speed kicks off this amazing chain reaction. It means treatments like chemotherapy can start way sooner. It frees up our brilliant human pathologists from the routine stuff so they can pour their brain power into the trickiest, most complex cases. It can even bring expert-level diagnostics to remote areas that don't have enough specialists. And what's the ultimate result of all of this? It can improve a patient's chance of survival. And that really gets to the core message here. This is not about machines replacing doctors. It's about augmentation. It's a powerful tool that basically gives our human doctors diagnostic superpowers, amplifying their skills, their reach, and their precision. It's a partnership. Which kind of leaves us with this one last really exciting thought. This technology has basically cracked one of the oldest and toughest challenges in hematology. Now that it can read the complex story written in our blood, you just have to wonder, what other huge medical puzzle is it going to solve next?